it is said that our fertility journey starts with the choices we make on our dining table. And that is the focus of my talk today, nutrition and female fertility. We know very well the various causes of female infertility, ovulatory disorders, endometriosis, tubal factors, pelvic adhesions, hyperprolactinemia, uterine abnormalities, and idiopathic. Today's talk is solely focused on the faulty ovum. What are the reasons of a faulty ovum? Is it anovulation, poor ovarian reserve, poor oocyte quality, oocyte maturation failure, or oxidative stress? We know very well that as we age, our ovarian reserves declines. And the acceleration occurs in early 30s, sometimes even early 20s. It could be even premature ovarian failure. Surprisingly, the overall incidence is at about 37.2%. And majority of these women with poor ovarian reserve need to undergo IVF. Anovulation, we all know the main culprit is polycystic ovaries. And stress. I would rather label stress as the first cause because too much of information easily available. Our generation, the new generation, has become a generation of overthinkers. It could be because of weight or exercise-related amenorrhea and other pituitary or hypothalamic disorders. Oocyte maturation failure. It is said that approximately 15.2% of all infertility patients, irrespective of the cause, produce at least one meiotically incompetent oocyte. And if more than 25% of oocytes are immature, then successful fertilization is reduced. Now, do we know what is oocyte maturation? We all remember our days of mitotic division and meiotic division. In mitotic, the entire set of chromosomes was transferred to the daughter cell, and meiotic, when half of the chromosomes are transferred. That is what is most important in the gametes, both sperm and the ova. So what is oocyte maturation arrest? It refers to a condition where the oocyte fails to complete the normal developmental process, and it is halted at a particular stage of meiosis. This is the special cell which is needed for gamete formation. Now we know what happens naturally in our body. We have prophase 1, which occurs in the fetal life where oocytes are arrested here until puberty. And as soon as there is a LH surge before ovulation, the meiotic stage which was arrested, it is resumed. And then, of course, there is a metaphase 2 arrest where the mature oocyte is arrested until it gets fertilized. So this is where the various stages where the maturation arrest can occur. Then it could be the poor oocyte. We've just talked about a poor oocyte. And so what is a good oocyte? It is one which completes the meiotic maturation, it gets fertilized, there is embryonic development, and ultimately to a successful live birth. Free radicals, they disturb the environment inside the follicle and deteriorate the oocyte quality. We will be talking about these free radicals and the importance of nutrition. So this is what happens in a defective folliculogenesis. This is just a pictorial representation to make it easy. You have a red, colorful, bright tomato, and as soon as it is attacked by the free radicals, this is what eventually happens. So severe oxidative stress in the follicular fluid leads to decreased oocyte quality, decreased fertilization rate. This could be because of DNA damage, change in the environment, and decreased availability of antioxidants. So I just talked about the presence of free radicals, I talked about oxidative stress, and then the availability of antioxidants. That is the focus of my talk today, nutrition and fertility. So what is oxidative stress? So I've added some other slides for my own sake because you keep reading about free radicals and oxidative stress. What is it? It is a condition where there is an imbalance between the production of reactive oxygen species, free radicals, and the body's ability to neutralize them. Now what are reactive oxygen species? In our body, there are multiple metabolic processes going on. So even a procedure like breathing, there is production of reactive oxygen species. So every activity which occurs in our body, there is something good and there is something bad. But there is a balance. When the impure products, they get excess in amount, leads to harm. What are free radicals? These are type of reactive oxygen species. They have an unpaired electron. So make them very potent, very reactive, and they damage the nearby molecules. What are antioxidants? These are simple supplements, nutraceuticals, that can neutralize the free radicals and prevent them from causing damage. So this imbalance in the production and then imbalance in the maintaining the neutralization, oxidative stress. When the body can't effectively neutralize these free radicals, oxidative stress occurs, which damages the cellular component, the DNA, proteins, and the lipids. So what are the factors which contribute to oxidative stress? Environmental, full of pollution, lifestyle, alcohol, smoking, not exercising, underlying conditions, chronic inflammation is coming up in a big way, and obesity. What is the impact of oxidative stress? It is early aging, shortening of the telomeres, chronic diseases. How does one manage in a very simple way? Change of diet, change of lifestyle modification, and then again we come to the supplementation. Again, this is what I'm trying to come to, our nutraceuticals and role in fertility. So what is the effect of oxidative stress on female reproductive health? Let's start with the uterus. Because of oxidative stress, there is prevention of implantation, endometriosis, preeclampsia, fetal growth restriction, miscarriages, abnormal placentation. All of them, there is an underlying pathology of oxidative stress. Coming to the fallopian tube, ciliary dysfunction, altered tubal fluid composition, impaired the smooth muscles of the tubes, so leading to increased incidence of ectopic pregnancy. Coming to the ovaries, there is reduced ovarian reserve, impaired folliculogenesis, DNA fragmentation, polycystic ovarian disease, accelerated ovarian aging. So all in all, there are different reasons, but the baseline is of oxidative stress. Coming to the oocyte, increased DNA fragmentation, impaired maturation, aneuploidy, mitochondrial dysfunction, and decreased fertilization rates. So here comes the role of nutraceuticals. How to overcome the common barriers of female infertility. So the few nutraceuticals I will be focusing upon are melatonin, coenzyme Q10, N-acetylcysteine, L-arginine, resveratrol, omega-3 fatty acids, vitamin C and E. We have been using them on and off in our practice, but there is one product which is having combination of all these. Starting with melatonin. It is a free radical scavenger. So it's like a gid which removes all the free radicals. And it increases the metaphase 2 oocyte count. I just mentioned about the meiotic division and the arrest which leads to a poor quality. So presence of melatonin increases these oocyte count, and obviously then there is more of grade 1 embryo formation. It improves the oocyte quality, it also improves the oxidative balance, and it has a, when it is used in IUI cycles, favorable effect not only on the follicle but also on the endometrial thickness. So what is the dose which is given? One of the randomized controlled trials were done where group A was given melatonin 3 milligrams from 3rd to 5th day of the menstrual cycle till the day of the trigger, and then the group B, which was the control group where no melatonin was given. What was the results? Though the group A, which received melatonin, there was higher number of retrieved oocytes, oocyte count, and of course, grade 1 embryos. So the conclusion is that melatonin improves the oocyte and the embryo quality. Coenzyme Q10. It is also a very powerful antioxidant, and it is the ubiquinol part of the coenzyme Q which has got greater bioavailability. It has been found that when given in elderly women more than 35 years of age, it leads to a better response to ovulation induction. So does coenzyme Q10 supplementation improve fertility outcomes? In patients who are undergoing IVF, again RCT was carried out, and it was found that when women who were given CoQ10 oral supplementation, a study was done, we had taken literature from PubMed and Cochrane. The result was increase in the clinical pregnancy rate, increase in the number of day 3 high quality embryos. So it acts as a protector of ovarian reserve, increases the clinical pregnancy rate. We all have been using N-acetylcysteine in patients of PCOD. It induces and it also augments ovulation, especially when you're giving patients exogenous gonadotrophins. In advanced age women, it is found that it promotes oocyte development capacity. So when given in the dose of 0.6 grams 3 times daily, from the menstrual phase of the previous cycle for 45 days, especially in cycles where the antagonist protocol was used. It was found there was high quality blastocyst, and also the glutathione level of the follicular fluid was increased. So in women over 35, we know very well that the ovarian reserve declines and the rate of miscarriage increases. This is due to the poor quality of the oocytes, diminished ovarian reserve, and also because of the decreased developmental competence of the oocytes. It is beneficial, NAC or N-acetylcysteine is beneficial for follicle development, important role for cell survival. All in all, it improves the ovarian response. L-arginine we have been using, we use it a lot, and we know that it modulates the endometrial vascularity. However, the dose which we use, mostly we use 1 or 2 pouches, sachets are given once or twice a day. Now each sachet contains around 3 to 5 milligrams, but the dose here in one of the RCTs used was 16 grams. So if you're using a 5-gram pouch, at least 3 pouches, or maybe if 2 gram, 5 pouches in a day. What was found, the result was that the group wherein arginine was used daily, it had lower cancellation rates, high number of oocytes, good quality oocytes, and improved pregnancy. Now why arginine? Because there is an increase in plasma L-arginine, citrulline, and nitrate levels. Nitric oxide we know is a regulator of ovarian function, and it becomes, because the presence of nitric oxide and improved vascularity makes it more permeable to plasma proteins and increase susceptibility to FSH. Then resveratrol, it also has a beneficial effect on the follicular pool and the oocyte quality. It also induces micronode modifications. It was again an RCT was done where they had given resveratrol. The result was there was increase in the number of good quality oocytes. Improves the follicular microenvironment. Use of omega-3 fatty acids, yes. It was found that women who are taking omega-3 supplements, they had 1.5 times more probability of conceiving compared to women who were not taking omega-3 fatty acids. So it may present a feasible and an inexpensive modifiable factor to improve fertility. We all have been using vitamin C, D, and E in various ways, but a combination together, how does it make a difference? Vitamin C, it is required for follicular growth, improves the collagen synthesis. Vitamin D has a vital role in follicular genesis. It regulates the ovarian and endometrial cell proliferation. And vitamin E we know is a very powerful antioxidant. It reduces the oxidative stress. Use of micronutrients like selenium, chromium, and zinc. It improves the ovum health and quality. It has antioxidant activities. So, what are the common barriers we have encountered? So end of the talk, we came to know about the poor ovarian reserve, we came to know about oxidative stress, we came to know about ovulation induction, impaired ovulation induction, poor quality of the egg, failure in fertilization, failure in implantation, and limited ovum retrieval in IVF cycles. Lineator F is a new kid in the block. It is a broad spectrum female fertility nutrition supplement. It is present in a sachet form. It overcomes the barriers. It improves the ovarian response. It reduces the oxidative stress, helps ovulation induction, better oocyte quality, high fertilization rates, improves the oocyte retrieval, and also improved IUI and IVF outcomes. Because of the presence of melatonin, it is advised that the patient takes the sachet at bedtime with 100 ml of water. Thank you.